Thanks for staying with us. The number of infections in South Africa around the coronavirus continues to climb, with the country nearing 10,000 coronavirus infections. As we've been reporting, the Western Cape remains the biggest contributor to those numbers, with Health Minister Zweli Mkhize committing to beefing up that province's response. Let's talk about some of the trends we're seeing unfolding. I'm joined via Skype by Adrian Puren. He's from the National Institute of Communicable Diseases. Adrian, thanks as always for joining us. We've been taking a closer look at the numbers that we and media houses across the country are reporting on a day-to-day basis, and asking the question about what we can glean from those numbers, and are we taking the correct information from those daily numbers. We heard from the Health Minister yesterday saying that despite 186 deaths so far as a result of COVID-19, the net death rate has decreased during the pandemic. Looking at the statistics today, 186 deaths, 9,420 positive cases identified. What, in your position as a specialist, are you gleaning from what we're learning from this virus?
Well, I think what those figures are showing in particular is that there's still a trajectory of increase in the number of cases. That means that there is certainly evidence of community spread, and we've seen that from the anecdotal reports in the newspapers and in the news. And I think the concern is what that trajectory means with regard to, and that's obviously in the forefront of our minds in terms of the lockdown, in other words. And I think that we need to look at those figures in particular settings, for example. So you've seen in the Western Cape a very exponential growth, even before the extension of the lockdown and before the change of the lockdown from level 5 to 4. We've certainly seen a marked increase in the numbers in the Western Cape, as well to a certain extent in the Eastern Cape as well. And that may, in the case of the Western Cape, may well have to do with the strategic approaches to testing that perhaps other provinces are not currently doing. I understand that there have been about 8 million South Africans that have been screened so far, but the positivity rate there is about 3%. But what you can see is that the number of cases we are identifying per number of tests has certainly declined. So that does show that there's certainly an increase in the number of cases.
Now, a part of your expertise includes HIV and STIs that you've spoken about on various platforms over the years throughout the work that you've done. When you look at your study of the coronavirus's behavior, what stands out for you about its behavior as compared to other viruses?
So currently we still don't have much information I guess because we're one of the countries that has the largest population living with HIV and TB. We must not forget TB as well. And so we've had some isolated reports from China, from New York, which tends to show that individuals who are HIV infected but have virally suppressed, their outcomes are no different from those individuals who are not infected. So, but I think we still need to be cautious here in South Africa in terms of that large number of individuals, and especially those individuals who have not been tested or who have been tested, know their status, but are not on treatment and have a poor immune status. So I think that will be one of our major concerns, because we've already seen from the data from the Western Cape and from the national data that certainly age is a factor with regard to poor outcomes, including death, as well as diabetes mellitus and hypertension, for example, are certainly key contributors. Whereas I noticed from the Western Cape data, HIV is not a major contributor, but that may just be because within this particular stage of the epidemic, we're not seeing that many people with HIV infected as part of that particular group of individuals reaching our hospitals. But that's the major concern. I know people talk greatly about herd immunity, but I think the concern is that when we look at our health system and its capacity, it's still really important, as I said, for those individuals who don't know their HIV status or their TB status to really be tested in order for them to go on to antiretroviral therapy. Because I think the concern is that if we just simply allow the expansion of this, which will happen inevitably, we may well overwhelm our particular health system. So I think certain levels of the physical distancing, the hand hygiene, the wearing of masks, the preparation of workplaces, preparation of schools still needs to be in place. And if you don't have to be on the streets or at the malls, then my advice is that stay away, because those are the high-risk areas that certainly contribute to the spread. And obviously, in our communities where it's very difficult to manage physical distancing, for example, hand hygiene, I know that those are great struggles. And so what are the ways in which we can try and be innovative in terms of managing those aspects of reducing transmission? I think transmission will happen. We're seeing that, but how do we manage it? So I know in the Western Cape, there's certainly been a two approaches, which is the community assessment, but also active follow-up of cases, isolation, and testing.
Well, you couldn't get any better advice than that. Thank you so much. Professor Adrian Puren, he's with the National Institute of Communicable Diseases. Always great to have an opportunity to pick his substantial brain.